Man down in the middle of the mall.
Okay. Arrive on scene, scene safe. One patient. Looks like he's in cardiac arrest as we approach. Unit 6-9, we're requesting an additional unit. We feel any pulses as he looks blue, Dan? No pulses. You're a first responder. You know how to do CPR?
Yes, sir.
Can you start CPR?
Yep.
Lovely. Nick, can you get the pads on?
1, 2, 3, 4.
And
6,
I will
7,
get
8,
the bag. I'll throw the pads on. You grab the bag valve mask like you were doing. Thank you. Okay, just stop compressions. If you want to, Nick, get a second here, check his airway and see if there's nothing. I have a shockable rhythm on the monitor. Okay, I'm clear. Nick, just clear for a second. I'm clear. We're going to go up to 150 joules. I'm clear. You're clear. Everybody clear, if this ever charges. And shocking now. Shock delivered. Right back on the chest. 30 and 2 for 2 minutes. I'm going to haul out my app. And we are going there in 30-second interview. Okay. I'm going to go and get an IV. Airway's clear, is it? And are you going to chest rise and fall with... Lovely. Hard working with a tether on.
5, 6, 7, 8, 9, 10.
I'm just right beside you here with the needle. How many rounds are you through, sir?
This is my favorite. 5, 6, 7, 8, 9, 10.
Still getting good compliance.
Getting good compliance?
Yeah.
Great.
Do you want a King LT?
If you have a chance to put a King LT or you can pull it out in between breaths and get it ready, that would be lovely. Okay, we've got a line ready, running wide open. This is your last cycle, sir. So we're going with 1 milligram of epinephrine. We're at 2 minutes there. Just stop compressions for a moment. I'm going to check and see if we have a pulse, carotid pulse. Okay, no pulse. So we're in a PA. If you mind switching who's doing compressions would be lovely. Right on. Yep. Mind handing me a container?
6,
I can squirt this in.
28, 29. Very good.
That's fine. Okay. And first dose of epi is in at 3:30 on the clock there. We're going to get our dose. Okay, so did anybody see what happened here?
No.
No?
We're walking in the
Just
mall.
walking in the mall? No, nobody knows this gentleman?
Yeah, his brother's
Okay. Can we talk to him? Does he, I'm just going through H's and T's right now. Does he have any medical conditions at all? Just high blood pressure? Has no other problems with his heart? No. So hasn't had any bleeding, anything internal, external, no GI bleeds that he's mentioned or anything like that? Gastrointestinal bleeds?
Nothing.
Okay. Hypovolemia, hypoxia. We're getting good chest rise and fall. It doesn't have a history of chronic lung disease. Hypothermia. Hyperkalemia, no history of renal failure. Is not in an acidotic state that we think being sick. We'll check a blood sugar here on him in a few minutes. And okay, and no history of hypokalemia. I forget in here. I said them all. That's why I don't. There's no more. We are at, how many cycles are we at? Okay. So we are at, I'm going to start a timer. If I can. I can't. Okay, we'll get that. So we're epi at 3:30. Okay, I'm going to, and as far as no trauma recently, do I have pulses with compressions? Okay. Visible JVD? No jugular vein distension. Okay, we'll see, but we do have compression, so it doesn't seem like cardiac tamponade, or we'll have a listen to his lung sounds during our next breath. Switch. Okay, are you done 5 cycles? We're going to just stop compressions. Okay, we're in course VFib. We're going to charge again in shock. So charging. Everybody clear. I'm clear, you're clear, everybody clear. Shocking now. Shock delivered. Okay, because we're in VFib, we're going to get some amiodarone going. 300 milligrams of amiodarone. And as far as the rest of he didn't have hyperkalemia, no tension pneumothorax, no toxins, pulmonary or coronary thrombosis. No way for us to tell, but he does have some cardiac history. So we've gone through our H's and T's. You guys think of anything why this gentleman's in cardiac arrest? Do we know? So he was just walking along in the mall with you, sir, the brother? And was he feeling fine at that time, or?
He's feeling a little weak.
Okay. And he's on what medications is he on?
He's only on one blood pressure all days.
Okay. And he has no allergies to any medications? Okay. And no other medical conditions other than the high blood pressure? I'd have gloves on, obviously. Okay. Got our amiodarone. I'll swab off my port. And in goes 6 milligrams of amiodarone, which has 6 mils, which has 300 milligrams of amiodarone is in. And this goes to the Sharps container. Okay. Okay, so we've got a King LT in. We're getting good chest rise and fall. We're just about up we're at 3:30, so we're just about time for, we can go with our epi. I'm just going to wait. How many cycles are you in right now?
That's number 5.
This is number 5? Okay, we'll just wait and we'll analyze and we'll go for another epi at that time if we need it, because we're just about at the 5-minute mark. Lines running wide open. Probably have a liter or half a liter in. So we're doing good compressions. We got good airway. Feeling pulses still with compressions, and we're just waiting to get through. So we're at 5 now.
Yeah.
Okay. Just stop compressions. You can switch. Okay, we have a shockable rhythm. We have V fib on the monitor. So just going to charge here. Oh, and we lost pad connection. Awesome. Okay, pads are back on. We'll charge again. Okay, I'm clear, you're clear, everybody clear. Shocking now. Shock delivered right on the chest. Another 32. So we're going to go with another epi at 9:30 on the clock. We're a little bit long with that epi. So another milligram of epinephrine in. Okay, so our next one's due. Okay, I'm going to start with good compressions, good CPR. Okay, the line. Okay, I think I'm going to work on getting set up to intubate him. Just let me know when you're at 5 cycles, please.
Twelve and a half minutes. Another minute. 12 minutes. 30 seconds.
So, stop IC burst. Tubes. Oxygen is connected there.
10 seconds.
Skew air. Pharmacology, we don't need any right now. And bougie, alternative device. Okay, so we're back to shockable rhythm here again. So just clear off the patient. We've got a V-fib on the monitor. I'm clear, you're clear, everybody clear. Shocking now, shock. And just rather than letting that hang, just disconnect it when you let go of it.
You taking this out?
Nope, we'll leave that in for the time being, just until I'm ready. I'm just about ready. Okay, we're gonna go with another epi. We were at 9:30 for our last one, so we get another epi in. Amiodarone, we're not. We're ways away from our second dose of amiodarone, so we'll do another epi. So the last one was at 9:30, and we're at 12:30 now. So another 10 mils of preloaded epi, 1 in 10,000, 1 milligram in 10 mils. So another epi in at 13:15. Okay. Okay, we've been shockable rhythm. We're ready to go. I'll get him, have a look and see what we can see as far as intubation. I don't want to spend any time. You know, we're getting good chest compressions for the time being. We are in good chest draws and full. Let's leave that be. We'll see where we go. I'm just going to get this amiodarone, our second dose of amiodarone ready. So amiodarone, 150 in 3 mils. Good expiration date. How are we doing? You guys, any word on our other truck? Are they hung up? Hell.
That's all.
Okay. Well then.
Good? Let me know.
Are we just about done? Okay, we have an organized rhythm. Just one second.
You have a parotid pulse.
Okay, we have a pulse. Okay. Can you put the bag valve mask on? If you want to just establish a respiratory rate of 10 per minute, I will need your calculator here in a moment. So if you put that on, just count 6 seconds and then respiration. So we're not going to need this amiodarone right now. Thank you, sir. So return of ROSC at 15:03 and 15:30 on this. I'll go by this time here. Okay. So we have, do you mind, we'll see if we can get some other vitals on this cat. Blood pressure, see if we have any SpO2. What's his color like right now, Dan?
He's still loaded on the blue side.
Okay. Pupils, look at you, you're a very, pupils, flora and sluggish. Okay. King LT seems to be seated in the right position.
It is.
Okay. I'm just going to have a listen here. Do I see any JVD at all?
No.
Nice to big breath for me. And again. Again. Okay. And once more. Okay. So, we're in blood air entries clear. Normal heart sounds? I am really caught now. I'm not used to operating with a leash on me. It's supposed to be on the patient. Okay, so what did our blood pressure come back at?
68 on 40.
So 68 on 40. How much fluid is left in my bag?
250 mils.
Okay, we're gonna keep running that wide open. And Nick, if you want to get us another, oh, perfect. And we'll get a 12 lead on him as well. There we go, sir. Okay, so we're hypotensive, post-cardiac arrest. He's not alert. Don't have any means to cool him at presently, but we're concerned about his blood pressure. We have good tidal volume at present, and we're shut down in the peripheries. Cap refill and whatnot in the peripheries is shut down.
Yes.
Matches my blood pressure. Okay, I'm going to start getting a presser ready. Do we have dopamine here? Okay, dopamine. Into 60. Tell me the Biratrol's here. Do you mind grabbing that Biratrol just hanging above the sink there? So, I'll figure out his math. So what do I figure he weighs?
90 kilograms.
90 kilograms. 90 kilograms. We're going to start off with 5 micrograms per minute. Thank you. So 5 kilograms per minute. 5 micrograms per kilogram per minute. So 450 micrograms per minute. I'm sorry?
Nothing.
Oh.
Thinking out loud.
We have 1,600 micrograms per mil in the bag. want to give 0.281225 mils. We're going to use a 60 drop set. So we'll call her 17 GTs per minute.
12 lead on there.
12 leads on. Okay, we'll hit and acquire a 12 lead. Going to recycle another blood pressure. And do you want to hang another bag of saline? We'll hang another bag of saline while I'm priming this dopamine.
And the blood pressure goes back to the same, and your 12 lead shows us the elevation from 3, 4, 5, 6, and 1.
Okay. So, I'm going to turn this off for the time being. Am I in view of that they can see? Prime my dopamine. I'm going to put 40 mils should be enough for the time being. Okay. So our dopamine needs to go higher. Lovely that this doorknob was here. Dopamine needs to go higher than our bag. I'm going to run our line. Dopamine out.
The line for you.
Okay, line is run out. And you have a metronome for me on your phone, don't you? Because mine's recording at present. So I'm going to piggyback this into my saline. We just hooked up our second leader. Our blood pressure came back as low again, 60 something on 60 systolic. So we're running our, we'll just hang this off the end. And we're going to, so we've got 1 liter working on our second liter. And we are just going to plug this dopamine into our primary line. It's running. And I'm just going to grab my notebook so we can, and I said 17 drops per minute, so we're just going to go to 17 on the metronome. Okay, we're doing okay breathing? Still have a pulse? Still monitoring that. We've been taking a blood pressure, but please. Okay. So, my line is okay, we're at 17 drops per minute with our buretrol. We have we don't have thrombolytics on our car, so we need to get to a cath lab right now. So we'll bring the stretcher in and we'll load him up and get going. Love to get him intubated, but I think our biggest priority right now is to get him to a cath lab. So we'll just see how we do. We might get that done en route, but I think we'll stop there.